Hi, Miss Boslett. My name is Victoria. I'm
Nice to
going
meet
to
you.
be your provider today. We're going to be doing a health history on you.
Okay.
What brings you to the office today?
Just an annual check.
Okay, when was your last annual check?
Maybe about a year and a half ago.
Okay, do you have any specific concerns that you want to cover today or just a general check?
No concerns.
Okay, well, we're going to be going through quite a bit of questions,
Okay.
so just bear with me and we'll try and figure out what's best for you.
Sound good?
So, how old are you?
31.
Okay, when was your last health wellness check?
Like a year and a half.
Okay. Is there a specific reason you're getting a health wellness check today?
Just routine.
Okay. So you don't have any major complaints right now. So I'm going to go ahead and just get a general health history on you, okay?
Okay.
First of all, do you take any medications?
No.
Do you take any supplements?
No.
Do you take any vitamins?
No.
Is there a reason you don't take vitamins?
I get everything out of my diet. I eat pretty healthy.
Okay. Are you on oral contraceptives?
No.
No. Okay. Have you ever been on oral contraceptives?
I was for a couple months.
How long ago was that?
Years.
Years. Okay. Random question. Have you ever borrowed medications from family members or friends for any reason?
No.
Okay. That's good. Let's talk about your allergies. Are you allergic to any medications?
No.
How about foods?
No.
Insects?
No.
Do you have any environmental allergies?
No.
Okay. Do you have any signs and symptoms of any kind of allergies we should address today?
No.
Okay. Do you smoke cigarettes?
No.
Have you ever smoked cigarettes?
Maybe when I was 23.
Just recreationally?
Yes.
Okay. Do you use e-cigarettes or any kind of smokeless tobacco?
No.
How about drugs?
No.
Never? Okay. Let's talk about your past medical history. Did you have any childhood illnesses I should know about?
I had chickenpox
Okay.
and rotavirus.
Did any of that cause you to be hospitalized?
I was hospitalized for rotavirus.
How old were you?
10.
Have you had any lasting effects from that? Everything's fine since then. Have you had all your vaccinations?
Yes.
Did you get all your childhood vaccinations?
Yes.
Did you get the flu vaccination this year?
Yes.
Okay, that's good. So let's talk about your past medical history. Do you have diabetes, hypertension, hepatitis, anything like that I should know about?
No.
Do you have any chronic medical conditions?
No.
None? Okay, perfect. Have you ever had any surgeries?
I had my wisdom teeth removed, but that was about it.
Okay. Let's talk about your OBGYN history. Are your menstrual cycles normal?
Yes.
Do you have pain with them?
I mean, some mild cramping every once in a while, but nothing crazy.
Are they? Do you have any heavy bleeding?
No, it's pretty regular.
Have you ever been
Normal.
pregnant?
No.
No. Okay. Let's talk about, back on that note, do you have any sexual dysfunction at all? Everything's normal in that category?
Mm-hmm.
Okay. Let's talk about psychiatric illnesses. Have you ever had any depression or any kind of psychiatric history?
No.
Never? Okay. We've already talked about your immunization status, so let's talk about your family history. Are your grandparents on your mother's side still alive?
No.
Okay. Do you know when they died?
Yes, my mom's my mom's mom, passed away at 93.
What was her cause of death?
She had a stroke and then was in a coma for a couple weeks after that, so residual of that.
And your mother's father?
He passed away. I know he had heart problems, but I think he had some sort of cancer as well. I don't know what it was. He was in his 70s or 80s.
Okay, let's talk about your father's side. Are his parents still alive?
No.
Both of them gone.
Yes.
What was the grandpa's cause of death?
He was mainly just old age. I mean, he didn't have that many medical problems, to be honest.
And the grandma?
She had heart problems, but she ended up dying of sepsis. But
Secondary to what?
I don't remember remember what I think she got like pneumonia and then just got progressively worse from there.
All right. Is your father still alive?
No.
What was his cause of death?
Prostate cancer.
Did he have any pre-medical conditions prior to his death?
High blood pressure and high cholesterol from his mother.
Did he have any surgeries, any kind of cardiac issues, anything that we should know about?
Yeah, he had a pacemaker.
Why?
He went into cardiac arrest in his 40s, early 40s.
And had no residual deficits?
No.
Okay. How about your mom? Is she still alive?
Yes.
Okay. Does she have any medical conditions?
She's borderline hypertensive, and has had multiple back surgeries, hip replacement. It's mostly ortho stuff.
Okay. Do you have siblings?
2 older brothers.
Okay. Do they have any medical problems?
No.
Okay. Good. So, has any of your family, besides the ones you've mentioned, I'm just going to ask, have they had hypertension? Your mother has borderline. Have they had heart disease? Your father had that. How about high cholesterol?
My father too.
Okay.
And his
Your-
mom.
Your grandmother had a stroke.
Mm.
Has anybody in your family had diabetes?
My aunt. That's it.
Okay. Has you or anybody in your family had thyroid issues?
I don't think so. No.
Okay. How about renal disease or arthritis?
My dad's mother had rheumatoid arthritis.
Okay. Has there been a history of tuberculosis, asthma, or lung disease?
No.
No. How about headache, seizure disorder, or mental illness or suicide?
No.
Okay. Has there been any history of substance abuse in your family?
No.
Okay. And has there been, besides the prostate cancer that you mentioned with your father, any other kind of cancers in your family?
I want to say my mom's dad had cancer, but I don't know what it was. I want to say like stomach or something.
And last but not least, is there any genetically transmitted conditions in your family?
No.
Okay. So we're going to go ahead and move on to your social history. Do you have a good emotional support system?
Mhm.
Where do you live?
In a house.
Do you live with someone? Do you have a good support system?
I have a roommate.
Okay. What's your typical coping style?
Pretty good, I think.
Okay. What do you do for work?
I'm a nurse.
Okay. Do you find that stressful?
Some days.
Do you cope with it well?
I think so.
Okay. What's your highest level of education?
I have a master's
In?
nursing.
Okay. Do you have a significant other? No. Okay. How's your sleep? Do you sleep well?
Usually.
Okay. You seemed a little reluctant when you said that. Is there something that's influencing your sleep? Do you feel like you're not getting enough sleep?
Yeah, but I don't know who gets enough sleep.
How many hours a night do you sleep?
It depends. 6 to 8.
Okay. Is that enough for you?
I'd like to be closer 7 to 8 than 6.
So your job history, you did mention that you were a nurse.
Mhm.
How long have you been a nurse?
Almost 7 years.
Are you satisfied with your job?
Yeah.
Okay. Are you trying to expand your field? Are you trying to do something different? Or you're satisfied with where you're at?
I'm going back to school currently for my nurse practitioner.
Okay. How are you dealing with the stress of that?
Good. I mean, it's a lot, but
Okay.
it's okay.
Are you financially secure?
Yes.
Is there any issues that we should address? Do you need any resources? No? Okay. What do you do for your activity daily? You
Well,
exercise?
right now it's work and school,
Okay.
and I exercise.
Do you have a good, healthy, balanced exercise and diet?
Yes. I work out usually 5-6 days a week.
Okay. Do you use dietary supplements?
No.
You don't do any muscle building supplements or anything like that? Okay, that's good. How's your caffeine intake?
I maybe drink a cup of coffee a day.
Okay. And that doesn't cause you any problems, no palpitations or anything like that, correct?
No.
Okay. Safety measures. Do you wear a seatbelt?
Yes.
Do you have airbags in your car?
Yes.
Do you wear a helmet if you ride a bike?
Yes.
Do you have smoke detectors in your house?
Yes.
Perfect. Do you participate in any alternative healthcare practices at all? Okay, that's fine. And we've already reviewed your social interest in alcohol and tobacco, and you mentioned you drink infrequently and you don't use any kind of tobacco. So let's go through a few things. Have you had any unusual weight loss? Is your weight stable? Have you had weight gain? Anything like that? Good. Do you have any rashes or lumps or anything that you've noted on your skin? Have you had headaches, a head injury, dizziness, lightheadedness, anything like that we should address? Perfect. Have you had hearing issues, tinnitus, vertigo, which is dizziness, ear infections, any discharge from your ears, anything we should evaluate there? No. All right, runny nose, any stuffiness, any sinus problems, any issues with your nose at all? Perfect. How about your throat? Any dryness, any soreness, any dry mouth? Are your teeth okay? Is there anything that we need to address there?
No.
Good. Any swollen glands in your neck, any stiffness in your neck, any pain with movement, anything there? How about your breast? Do you do self-breast exams? Okay. Have you noticed any lumps, any swelling, any drainage, anything? Okay. Any cough, congestion, any shortness of breath? Do you get short of breath when you're doing exercise? Do you have any chest pain when you take a deep breath? Everything's good. Perfect. How about chest pain? Any kind of pressure in your chest, palpitations, anything that doesn't feel normal with your heart? That's all good. How about GI? Do you have a good appetite? Do you have any trouble swallowing? Do you have any indigestion, any heartburn? Any diarrhea, any bloating, any cramping, anything like that? All right. Any numbness or tingling to your hands or feet? Any swelling in your legs? Nothing like that, even with exercise. Okay, good. As far as your urinary thing, do you have any dysuria or pain with urination? Do you have frequent urination? Is there a foul odor to your urine? Is there anything that you've noticed with your urinary tract? Any itching or burning? No. As far as that goes, about your genital area, is there any discharge? Is there any swelling? Is there any foul odor? Is there anything we should address?
No.
No? Good. Musculoskeletal, I know you work out a lot, but do you have abnormal muscle pain? Any joint pain? Any creaking in your joints? Any...
Sometimes.
Where?
Knees and my hips.
Okay. Have you ever had that checked by an orthopedic?
Yes.
Has it been debilitating?
No.
Okay. But you have normal motor activity and it sounds like you're very active. You mentioned before that you've never had any psychiatric problems, but have you ever felt uneasy, some nervousness, some anxiety? Is there anything that just hasn't quite felt right? No? Good. Have you had any anemia? Have you had bruising that you can't explain? Anything that would point to a blood disorder? Okay, good. You have any heat or cold intolerance?
My hands.
What goes on with your hands?
Cold intolerance.
Like, do you have, they go numb, they're just cold, they lose color, what happens?
They lose color.
Okay. Have you ever seen a doctor for that?
No.
Have you been diagnosed with anything specific to that?
Probably Raynaud's.
Okay, perfect. Okay. At this point, if there's any concerns that you want to bring up and that we can address specifically, I feel like I have a good medical intake. Do you have any questions for me?
I don't think so.
Did you have any specific goals for this visit? Okay, perfect. All right. Well, I appreciate you coming in, and if you need any follow-up or you have any further questions, please feel free to contact me.
Sounds good.
All right. Thank you, Anne. It was a pleasure to meet you.